October is Breast Cancer Awareness Month. In the important effort to raise awareness, the Toale on the News, Niagara Gazette, and Lockport Union Sun and Journal have collaborated and gathered local stories related to the disease.
The trends are for early detection and for patient convenience in a pleasant setting to decrease patient anxiety. There have been advances in technology with digital mammography, with dedicated ultrasound, and with MRI as well. So those are all out there for early detection. Well, they're going to come through the outpatient setting, and they're going to have the mammogram done, and if additional studies are and procedures are needed, they will have those done as well, and they will find the results in almost all the cases while they're here, and if they want to discuss the results with the radiologists and technologists, they can do that as well. Okay, well, we already have the digital mammography equipment, and we're upgrading our ultrasound very shortly, and it's going to have dedicated probes for mammography for breast ultrasound, and we're actually looking very closely to obtain the best breast ultrasound out there. We're also upgrading our MRI unit, and part of the upgrade is going to be a dedicated breast coil. It's going to mean that they will get the best equipment available in all of breast imaging, and also they will hopefully feel comfortable that they don't have to go elsewhere to get the best technology and best imaging experience in breast cancer detection.
Two different times that I had breast cancer. When a woman's pregnant, you go in usually, okay, you think you're pregnant, so you go see your gynecologist, and the doctor checks you out. When the doctor started checking me out, of course, they feel around for if there's any lumps or bumps or anything, and that's when the doctor found the lump. Then I had to go through all the tests, but of course couldn't have an x-ray or whatever because I was pregnant. I could feel her moving. And I waited a little bit longer because I already had 2 previous kids. So that's why I didn't go in right away. It's not a hereditary, so it's something I was exposed to growing up, or something I ate is what they say that why I got the breast cancer. I almost lost my 3rd child during the surgery. When they took my breast, the anesthesiologist, the baby's heart rate dropped during surgery, and she started yelling at the doctors to hurry up. So I was like, whoa, the anesthesiologist is yelling at the doctors. But my daughter survived, and like I said, she's in her 2nd year of college right now. So 14 years later, I was in for, because I'm also precancers for colon cancer, I was going to get a colonoscopy done, and we went to Dr. Hodge here in Lockport, and when I was there, I said, okay, Doc, I don't have anything to compare the other side with. Can you check out, because surgeons can feel things under the skin a lot easier and better than just a regular person. I says, can you check out this other side? Sure, no problem. So he starts checking it out. He goes, what's this? I says, what? He takes my hand and he says, right here. And it had me feel, I'm like, oh my God. So come to find out, after going through all the tests and whatever, it was a kidney-sized lump. They sent me off to a breast surgeon in Williamsville, Dr. Bauer. And after Dr. Bauer at the time, because previously, laws changed and whatever, this time I have to do the reconstruction. They said, we can do it right as you're right there. You don't have to come back. We can take the breast tissue from yours, and then we can start reconstruction right there. Had a meeting with the breast plastic surgeon, and he said, yeah, what we do is I assist the breast surgeon who's taking the breast tissue, and then when he's done, then we switch roles, and then he assists me with the reconstruction. Then after a few years, I saw some videos where women who have had surgery for breast cancer scars or whatever, end up getting a tattoo over top of the scars. Well, I've got flowers, and to me it looks so much better than looking at the ugly scars.
We just had the 18th annual Mother's Day Breast Cancer Canal Walk. But it's nice because it's the same date every year, the second Sunday in May. She passed away 16 years ago. It was 2 years after she started the walk. It's amazing how many survivors come and they meet up with other survivors, and it's just a really good thing for them to talk to other people that have gone through the same thing that they have gone through. She was an amazing, amazing person. I mean, just when you're around her, she was just always smiling, always happy. Even when she was going through chemo, it was amazing. That's her spirit. She helped so many women, and people will come up to me even at the walk and go, I remember your sister. She helped me through this, or she did this, or she said this, and it helped me get through what I had to get through. She's the one who came up with the idea for the wig room, and they called it the Wig Depot. And as time went on with, the canal walk doing so well and raising money, we were able to make a bigger room and a nicer room. So it kind of looks like a little salon now. She passed in 1998. It had metastasized, and that's generally what will happen. It will metastasize to the brain, but it metastasized to her liver and her bones. So that eventually took her life. She was only 42.
So Mary Marvin, Rebecca Florio's sister, was an employee of the American Cancer Society, and she actually co-founded the Mother's Day Canal Walk. The funds raised through the walk are really the primary funder of the wigs in this room. Once she passed away, and obviously after she had done so much in the battle against cancer, this room was named after her. So it's now Mary's Wig Room. And in 2013 alone, we've gave, I believe, 313 wigs out to women. This service is actually available across the country, but this room in particular services women in the 8 counties of Western New York. Really, part of our mission is to assist individuals when they're going through cancer treatment, when they're diagnosed, even after diagnosis. So we look to improve the quality of life for patients and their caregivers. So this is one of our services that does improve the quality of life for patients. So they look in the mirror, they're feeling better, it makes them more confident in their own cancer journey.
It's unusual, 1,600 men a year versus 200,000 women a year. I had an inverted nipple on the right side, and it was a bit of a tumor there. I was coming out of the shower. My wife said to me, we were in Niagara Falls, she says, you talk to a doctor when you get the cold. My wife took a look at my chest and she says, you need to have that looked at. I went to the doctor and he said, I want to do an ultrasound on that. He said, well, we think you need a mammogram after they did the ultrasound. And I said, okay, I don't know where this is going, fine. And about 10, 15 minutes later, this doctor, who I did not know, walked in, he's got all these images there. And he looks at me and he says, I think you have breast cancer. Boom. And it's just, it's surreal. I don't know how I can explain the feeling. I'm ill. I don't know what this means. How's my family going to react to all this? Your head, you can't even think. I had a couple surgeries. I went to Roswell. I actually had my choice. I could do radiation, chemo, or tamoxifen. Tamoxifen gave me about the same percentage of survival than the others, and I said, I'm not going to go through more stuff if I don't have to. So I opted for the tamoxifen. Unfortunately, 15 months later, there was recurrence. I had 2 more surgeries, and then I did 37 radiation treatments after that. Then they placed me on a treatment, Magestrol, and I did that for 7 years. And then 4 years ago, it'll be 4 years ago in October, they found that I have 2 nodules in one lung and 1 in another lung. I know this sounds unusual, but I was fortunate that they found it in my lungs, because had they found it in my brain or in my bones, I would have been gone by now. Can't let it get me down. I can't worry about it. I'm not the type of person I am. I I have so much more to live. I wake up in the morning and I look on the bottom of my feet and there's no expiration date, so I go on with the day. I know it's a serious thing. I'm savoring the moments every single day. I can't let this rule my life.